Hi, my name's Annette, and I'm the new substance abuse counselor at Indian Healthcare. I primarily work with the youth. I have a group on Wednesdays at 11 a.m. If you know any adolescents that would like to join us, we would love it. So, throughout history, human beings have looked for ways to cope with suffering and enhance their existence, hence why we have addiction. So, why can't opiate addicts just stop using? So we're going to talk about the mind and the limbic system. The limbic system is part of our brain that controls our basic physiological functions. This we'll refer to as our go system. This part of the brain controls five basic drives: hunger, thirst, sex, flight or fight reaction, and pain regulation. There's no conscious thought occurring in the midbrain and the limbic system, and these drives do not respond to reason. The midbrain and addiction. Addiction creates a sixth drive. So aside from those five we mentioned, addiction will create a sixth drive. It hijacks the pleasure and reward system in our brain. It creates a primitive push for addictive substances or a behavior that feels exactly like a basic drive. The sixth drive eventually grows so powerful that it eclipses all the other drives. The first five drives deal with self-preservation. The sixth drive deals with self-annihilation. The prefrontal cortex, we'll call our stop system. This is part of the brain that's responsible for our executive functions, including predicting consequences of our behavior, impulse control, planning for the future, personality expression, and moderating behaviors. Brain imaging of addicts shows the very decreased functioning in this region of the brain. Opioids are structurally similar to endorphins and dopamine. Those are the chemicals in our brain that make us feel happy. Your body will convert opiates into morphine, and they attach to your opiate receptors to relieve pain and cause pleasure. In 2015, 200 million Americans were abusing prescription opioids, and 591,000 were abusing heroin. 4 out of 5 heroin users started on prescription painkillers. So in our mind, decision making is affected. Addicts report feeling as though the choice to use is removed by the inability to regulate their impulses. This can easily result in feelings of self-doubt related to recovery, as well as overall functioning in life. Opioids are physically addictive, and withdrawal symptoms are so intense and so destabilizing that many opiate addicts will continue to use just to avert suffering from withdrawals. So our physical body is affected a lot by use of opiates. Most addicts neglect basic hygiene. They don't practice self-care because most of their focus is on acquiring and using the drugs. Addicts are at higher risk for comorbid health conditions. IV drug use can cause abscesses, Hep C, HIV, MRSA, and endocarditis. High-risk behaviors due to lowered inhibitions and the need to avoid withdrawal. Addicts often result in many high-risk behaviors, including criminal behaviors such as theft, assault, and prostitution. Addiction is a family disease. Having an addicted parent or child is highly destabilizing on a family. Addiction in the family often results in high levels of conflict due to erratic or dangerous behavior displayed by the addict. Non-addicted children often feel ignored or neglected as the primary focus is on the addicted sibling or the parent. Ron, what do you want to throw in about families?
Well, family. Family, we all know that things are hereditary, and some of us get passed down things that we don't like. Our inheritance sometimes isn't exactly what we want. If you have black hair, guess what? Your parents probably have black hair. If you have green eyes, maybe one of your parents had green eyes. So, if one of your parents was addicted, had an addicted gene, then guess what you've got passed down. And so, the family system is all affected by the addict. And I used to have a mobile that showed that one part, when one part moves, the whole part moves. When you have an addicted person in a family, it affects the whole family. And then after it affects the family, it affects the whole community. And so this problem is not individualized. And that's why a lot of times we suggest that we want you to participate in treatment with your loved ones. And you say, why? I don't have the addiction. Well, we want you to understand how you can help your loved ones. That's why we refer you to Al-Anon, Alateen, and different things to help the family. And here at Indian Health Council, we are currently in the process of getting some family programs started. And we already have some, but they're coming. They're coming to your community, and we need your help with that. So I liked what Annette said about the disease being the addiction as a disease, it being a hijacking. And so what happens in a hijacking? When your brain is hijacked by addiction, it doesn't work right. So when it's hijacked, that's all you think about is the drug. And your whole goal, that brain's whole goal is to get the drug, use the drug. And so you're not thinking normally. And so it's a spiritual sickness. There's no way you can have your spiritual life maintained if you're addicted to drugs. And as Native people, we are spiritual, and our culture is not about drug use. So what we want to do is help you return to the culture. And that's what we do. We use Wellbriety and other forms of treatment that are very, very effective for treatment. We use AA, NA, and a lot of Wellbriety and a lot of different things. We also find out that a lot of the people that are addicted, they have other issues, they're co-occurring mental health issues. And if they're not addressed together, then the client patient probably isn't going to get well. So today we address the grief issues, we address PTSD, and we address the full, all 6 areas of the life of the patient to help them recover. And so I am really, really proud of the treatment they have here at Indian Health Council. And we have a lot of great clinicians here. And we have a lot of AA meetings in the area. Unfortunately, right now, a lot of them are on Zoom, but we have a lot of good meetings around this area, and we have a lot of good cultural facilities, and we have a lot of good lodges, spiritual people, and we need your help to be part of that. This is the thing. This is our community, and we need your help with it.
Please reach out to us. We offer so many services. We want to help with family members also. We want to get some groups going to help the family members of the addicts. So please call the front desk and schedule an intake.